No food and nutrition security without WASH. This powerful message is currently being spread by the German WASH network, consisting of 18 German non-for-profit NGOs working on water, sanitation, and hygiene, together with WSP, the Water and Sanitation Program of the World Bank. In close partnership with BMZ, GIZ, the RUAF Foundation, SEI, SIANI, the Sustainable Sanitation Alliance, and UNSGAP, the German WASH Network and WSP hosted a seminar with exactly this title at the 2012 World Water Week in Stockholm. In the spirit of nexus thinking, the focus of this year's conference was on the connection between water and food security, thereby combining two fields of work that belong together. This short film allows you to revisit our seminar and hopes to contribute to better collaboration between both sectors. As experts in the field of WASH, we want to highlight to food security specialists where WASH impacts their field of work. At the same time, we realize that we should start with ourselves and begin by learning what food security really is. Food security consists of 4 pillars. Pillar 1 is the availability of food. This addresses the supply side, focusing on production in sufficient quantity, quality, and seasonality, delivering the food to local markets. Pillar 2 is the access to food. It considers the economic and physical capacity of the households to procure sufficient food in order to satisfy the nutritional needs of its members, leading to the third pillar of use and utilization. Starting with storage, it includes how food is processed, prepared, and distributed in the household. It also considers the individual's ability to absorb and metabolize the consumed food, making sure it stays in the person and doesn't end up in the toilet. The fourth and last pillar is the stability of the other 3 dimensions over time, considering possible inadequate access to food on a periodic basis, for example by adverse weather conditions or economic factors. Water, sanitation, and hygiene services have considerable potential to contribute to the advancements along all 4 food security pillars. So let's revisit them. For one thing, WASH can help to increase agricultural production. Reuse-oriented sanitation approaches view sanitation products as a resource and not as a waste. These systems can provide the soil with irrigation water, organic material, and valuable nutrients after proper treatment of the wastewater or excreta. Secondly, WASH increases access to food. The economic benefits created by WASH particularly benefit low-income households. And since food is one of their main priorities, additional income usually results in increased access. The extra spending helps to stimulate local food production markets. Furthermore, WASH improves the utilization of food by dramatically reducing cases of diarrhea, worm infections, and less visible subclinical diseases like tropical enteropathy, which cause malnutrition. Since families suffering from hunger are usually the same individuals living without access to WASH, governments struggling to feed their citizens can make substantial contributions to food security by making WASH investments. It helps to simply make more out of the food that is available. Finally, WASH approaches have the power to add stability to food security. Environmentally sustainable systems can prevent pollution of ecosystems while at the same time providing water and nutrients for reuse. By using systems that supply fertilizer and energy on a local or regional scale, the vulnerable users become more independent from global trends and the resulting price swings on the oil or fertilizer markets. Although all before mentioned connections between WASH and food security are very important, we decided in the preparation of our seminar to focus on the link which we believe is most neglected. The third pillar, talking about the human body not being able to efficiently utilize consumed food. Our seminar had the following structure, which was subdivided into several blocks. We began with an eye-opening introduction by Robert Chambers and Oliver Cumming, who highlighted the potential of the much-neglected link between WASH and nutrition security. With 30% of children in low-income countries suffering from undernourishment, it is time that we face up to the fact that this causes approximately 2.2 million avoidable deaths per year. WASH services can help to alleviate undernutrition and the stunting which can result from it. Robert and Oliver pointed to convincing evidence by Jean Humphrey and others that asymptomatic diseases like tropical enteropathy are currently being totally underestimated in their impact.
There is a significant body of evidence suggesting that poor wash plays a role in undernutrition, one. Two, that undernutrition increases the risk of infectious disease, so it increases the risk of infection and also severity, particularly in the case of diarrhea.
Fecally transmitted infections are far, far more than the diarrheas, and they have a terrible effect in sustaining the stunting of children around the world. The diarrheas are overemphasized because they're horrible. They can easily be measured, and professionally they give numbers which medical scientists and others can use. This has led to the neglect of things like tropical enteropathy and worms for that matter, which are very, very widespread.
After these insightful presentations, we widened our perspective by introducing 3 promising approaches to bring WASH to scale, and which can thereby contribute considerably to nutrition security. Almut Weitz and Juan Costain began by explaining conditional cash transfers, a successful approach from the health and education sectors, which gives cash incentives on certain conditionalities. By presenting case studies from Peru and Indonesia, Almut and Juan highlighted how WSP intends to alleviate poverty and induce behavioral change by including access to sanitation as one of the conditionalities.
So the examples we presented on Indonesia and Peru were both kind of trying to figure out a way of linking our ideas of what is needed in terms of sanitation advancement to existing programs.
The next presentation was to be carried out by Kamal Kar, introducing us to community-led total sanitation. Unfortunately, Kamal could not join us, but Robert Chambers delivered an excellent input on his behalf, explaining how CLTS uses emotions, like shame, to mobilize whole communities to end open defecation, thereby triggering collective behavioral change which leads to health improvements. The third promising approach for scaling up sanitation provision was presented by Musa Bonsi and Linus Dagerskog. Using examples from Burkina Faso, they explained how productive sanitation makes effective use of the nutrients and organic matter in human excreta and wastewater by returning them to the soil. This not only increases agricultural production, but can act as a motivating factor for striving for improved sanitation when people realize the fertilizer value of their treated excreta.
If we want to boost sanitation and also solve the problem of nutrition in a rural area in Africa, we have and we can use productive sanitation.
It's based on 2 pillars, which is sanitization and reuse. So we're conscious of what we do with the shit and the urine, which also means that we can eliminate pathogens before reusing, which also means that we have less chances of ingesting pathogens and thereby improving nutritional uptake.
After these presentations, we welcomed the input of more than 100 seminar participants. In 3 separate discussion groups, the speakers were joined by additional experts like Claudia Wendland from Women in Europe for a Common Future, Arno Rosmarin of the Stockholm Environment Institute, Arno Curva of Malteser International, and René van Veenhuizen from the RUAF Foundation. Together they facilitated discussions which were later summarized by a panel aiming to paint the way forward. In their final statements, the speakers called for a more rigorous research concerning the WASH nutrition link and demanded more policy coherence and cooperation between the food, nutrition, and WASH sectors. 2 specific outcomes could be realized immediately. For one, a WASH nutrition working group was initiated. If you're interested to join, please do contact us. Secondly, a slogan for communicating the importance of this nexus to decision makers and the public was born. Growing tall with toilets, shit stunts.
Nutrition and sanitation are fundamental determinants of good health, particularly for children. And many children either die or are very ill or don't reach their full potential because they don't have access to good nutrition and sanitation.
More than ever, water, sanitation and hygiene should be high on the agenda, but together with that, the professionals from different silos, different organizations, they have got to come together, perhaps through conferences and workshops, and put their heads together and collaborate much more.
I think there is a role for more rigorous research, one. And two, we need to think about policy coherence. We need to understand what are the incentives that are going to get the people who are concerned about nutrition around the table with the people who are concerned about providing water, sanitation and hygiene.
There could be a good opportunity for us of the WASH sector to actually link up with already existing programs at country level that would allow us to sort of multiply the effect of sanitation and hygiene on perhaps nutrition in a really large scale.
And we've come away with some very concrete ideas that we want to implement ourselves. First of all, the idea that we should have a brand, growing tall with the toilet. That's something we really want to use. It's something that we really feel makes the connection between reducing stunting and improved sanitation. Also, a suggestion we had as well that we should rework one of our studies, the Economics of Sanitation initiative, rework that in terms of nutrition. That again is something that I think we really want to work with and really put the impact of poor sanitation in terms of what that would mean in food terms. So how many hundreds of kilos of rice per person you would have if you had improved sanitation, and also how much taller children would grow with improved sanitation. These are great ideas, and we really appreciate the organizers for giving us the opportunity to hear those ideas.
And we would like to thank you for your interest in our seminar and in this vital topic. If you have any relevant data or insights that you would like to share with us, please do get in touch. We also encourage that you share this video with colleagues and friends, particularly from the health and nutrition sectors. The topic is way too important to be ignored, so let's work together.